When I first started practicing medicine about 30 years ago, in a very short period of time, I began to have the feeling that we were overusing medication, particularly in areas of chronic disease and even in chronic pain. I was thinking about my loved ones, and if they were experiencing chronic pain and chronic disease, I wasn't comfortable with the idea that we might just give them a prescription that would mask the symptoms of the disease and wasn't actually addressing some of the underlying causes. And I began to work and train extensively in this area and developed a career helping people use less medication, and in some cases even coming off medication. And that is not to say that everybody should be on less medication or coming off their medication, but for a group of people, they actually began to function better when they were less dependent on medication and began engaging in some lifestyle and behavioral changes to improve their health. As I talked to my physician colleagues, many people were in many circumstances trying to reduce some of their patients' dependence on medication, but they were not having a lot of success. And as I looked more closely at the situation, it seemed to me that what was lacking was a clear, concrete alternative to relying exclusively on a prescription medication. I started to toy around with the vast ideas of what involves healthy lifestyle, and it was wide and messy and a bit difficult to organize. But eventually, after multiple iterations, I landed on 6 pillars of lifestyle medicine that were based on science, were not testimonial but evidence-based, and really function to create health, prevent illness, and in some cases contribute to the treatment of disease. And it became clearer and clearer that these things weren't just to be reserved for people who had chronic pain or chronic disease, but they really were the things that we all should be incorporating into our lives every day. And these categories are sleep, nutrition, movement, relationships, productivity, and happiness and mental health.